Hi, my name is Ugo Uche with Road to Resolutions, and today I want to spend a few minutes giving my professional opinion about anxiety and more specifically panic attacks and how I go about treating clients who are struggling with panic attacks. If you notice, I am recording this on my cell phone. Not going to say what kind of cell phone it is because I am not advertising for anyone. But I did notice that this has a better quality than what's on my laptop. So, go figure. I'll try and keep my hands steady. Okay. So, anxiety and panic attacks. One word to remember about anxiety is adrenaline. Adrenaline is an important hormone that serves us well in life-threatening circumstances. A common example would be going for a walk in the woods and you come across a predatory animal, be it a mountain lion or a bear. What would happen is that your body would release adrenaline and you would start thinking on your feet, be it to turn and run away for dear life, maybe play dead, or maybe to make a lot of noise to scare away the animal. But either way, anxiety, adrenaline, comes in very handy, and it propels us to take action. So what happens in everyday circumstances where your life is not in danger? Maybe you are at the grocery store, the post office, the parking lot, and all of a sudden you experience rapid heartbeats, feelings of terror, sweaty palms. You feel your heart is about to jump out of your mouth. What's going on there? Well, what's happening is that people are experiencing what I like to call the perfect storm. So there are a series of circumstances, of experiences that they're currently going through, whether they're fully aware of it or not, and that they have certain feelings for. And the underlying theme of those feelings is that it's not fair and they shouldn't be experiencing this. Most of the time, people are not fully aware that they're struggling with this. And that's because they have core sets of beliefs and values that lead them to feel in a very unhealthy way towards circumstances not going their way. So feelings like you always have to be in control, you always have to be perfect, you shouldn't suffer, you shouldn't struggle. These are core beliefs and values that usually will set us up for the perfect storm. And can people get better from anxiety and panic attacks? Yes, they can. I use a combination of relaxation, mindfulness techniques, and intensive psychotherapy to get people to the heart of the issue of what they are dealing with, and to change, the paradigm of their belief system to a more healthier and emotionally resilient state of mind. So that's in a nutshell, that's my strategy. I want to talk about medication. People often ask me about medication. Most of the time I tell people they don't need medication because most of people I see don't need medication. Few times people do need medication, and that's when it's very severe, in which that they can't walk and they have to take time off from work, just really severe. And then I would say, maybe you should see a psychiatrist and continue to receive counseling. There are people who believe that medication alone will help them get past their experiences with panic attacks. The problem with panic attacks is once you experience it, until you address the core of your belief system, it's always going to come back. So you may go a period of 2 months experiencing panic attacks, and it goes away, and then it comes back a few months later. Medication will help you feel better, but only temporarily. Over time, your body is going to will build a tolerance to the drug, and you will require a heavier dosage. And over time, regardless of the dosage you're receiving, you're going to reach a point of diminishing returns, where the effects of the drugs are very minimal. And this is because the beliefs have not changed. So ultimately, if people insist on taking medication, I say, take a two-way approach with medication treatment and intensive counseling, and that's how people can approach a place of wellness. So I think that's all for now. I wanted to keep this as brief as possible. Thank you for stopping by. If you are viewing this on my website, roadtoresolutions.com, and you would like to learn more about what I do, go ahead and fill out your information in the contact area. I don't give out anybody's information. A big part of what I do is maintaining confidentiality. And until then, thank you for watching this video. Take care.